Nvidia outlined 4 significant areas of GPU design where artificial intelligence and machine learning can be leveraged to great effect, which include 1. Mapping voltage drop, 2. Predicting parasitics, 3. Place and routing challenges, and 4. Automating standard cell migration. In terms of number 1, mapping voltage drop shows designers where power is being used in a new GPU design. Using a conventional CAD tool will help a designer calculate these figures in about 3 hours. However, once trained, Nvidia's AI tools can cut this process down to just 3 seconds. Such a reduction in processing time helps a lot with a process like this, which is iterative in nature. The process, as it stands, offers 94% accuracy, which is the trade-off for the huge iterative speed increase. Number 2 is predicting parasitics. Nvidia's new AI model cuts down on the lengthy, multi-skilled process. The simulation error is reasonably low at less than 10% in this case, and cutting down these traditionally lengthy iterative processes can free up a circuit engineer to be more creative or adventurous. Number 3 is place and routing challenges, which are more important to chip design as they're like planning roads through a busy city. Getting this wrong will result in traffic jams, or data jams, requiring rerouting or replanning of layouts for efficiency. Using graph neural networks to analyze this issue in chip designs helps highlight areas of concern and act on issues intelligently. The 4th tool of Nvidia's chip design toolbox is using artificial intelligence to automate standard cell migration. Previously, it was a tremendous undertaking to migrate a chip design from 7 to 5 nanometers, for example. But now, using reinforcement learning AIs, 92% of the cell library was able to be done by this tool with no design rule or electrical rule errors. This introduces huge labor savings for Nvidia, and could be integral to the design of Nvidia's Ada Lovelace GPUs, as well as automating standard cell migration in some 7 nanometer to 5 nanometer transitions. AI21 Labs has built a breakthrough general-purpose natural language processing system called MRKL, an acronym for Modular Reasoning Knowledge and Language System. MRKL is designed to handle all kinds of natural language tasks, not just one specific job as most such systems have done until recently. There are some well-documented problems, though, with these ultra-large language models, including that they can be prompted to spit out toxic language, and also the fact that they have a tendency to produce inaccurate information in response to factual questions. For instance, asking OpenAI's GPT-3 to add several 4- and 5-digit numbers will usually result in the model confidently spitting out the wrong answer. Similarly, asking GPT-3 what the weather is like in New York will probably elicit a response, but it will likely be the temperature in New York whenever the data from AccuWeather was scraped into the training set, not today's weather. The same problem applies to questions about current events or even science. Because these large language models are so big, they're extremely expensive to train, in the millions of dollars, so it's not practical to constantly update them to ensure their data is up to the minute. This is precisely the problem that AI21 Labs has set out to solve with MRKL. MRKL is a hybrid system. It doesn't only use deep learning, which is the AI method that is responsible for most of the big leaps forward in the technology over the past decade, but instead it combines different modules, some of which use deep learning, and some of which use an older form of AI, symbolic reasoning, to provide accurate, up-to-date responses to factual questions. If the question involves mathematics, it sends that question to a plain, old-fashioned scientific calculator. If it involves exchange rates, it routes it to a currency converter. If it is about weather, it sends it to a forecasting website. There are 55 of these task-specific modules that MRKL currently supports, and if the router is unsure which module is best, it calls on 𝗎𝗏1, which is a large language model that AI21 Labs claims is better than GPT-3, used to help compose contextual language around MRKL's response. Another innovation is how AI21 Labs is able to elicit the right kind of response from the 𝗎𝗏1 model. It does this with a method called prompt tuning, in which the way an initial question or fragment of text is fed to the ultra-large language model helps determine the nature of the output. It's one way to adjust the AI for a particular task without having to fine-tune it with additional training data. The problem with additional training is that the system gets better at one narrow task and worse at others. Researchers call this problem catastrophic forgetting. Some AI researchers overcome catastrophic forgetting by training the model for a variety of disparate tasks at the same time, but this method requires a lot of computation, time, and money. Prompt tuning avoids this. AI21's innovation with MRKL is to create small deep learning modules that can automatically prompt tune 𝗎𝗏 on the fly, taking a user's query and composing the best set of prompts to nudge 𝗎𝗏 into coughing up the answers in the correct style and format. All of this together results in a breakthrough in general-purpose natural language processing to perform multiple tasks, such as posing as a customer service chatbot, while the same AI could also help analyze the sentiment of CEO earnings calls, as well as offer up-to-date factual data, plus serve many more roles on demand without constantly being retrained. Using MEG data, a new AI algorithm called AI Mind is able to assess dementia risk. The human brain consists of some 86 billion neurons, nerve cells that process and convey information through electrical nerve impulses. This is why measuring neural electrical activity is often the best way to study the brain. Electroencephalography, or EEG, is the most used brain imaging technique in the world. However, magnetoencephalography, or MEG, measures the magnetic fields generated by the brain's electrical activity. MEG signals are easier to interpret than EEG signals because the skull and other tissues don't distort magnetic fields as much. MEG can locate the active part of the brain with much greater accuracy, at times achieving millimeter-scale precision. The world's first whole-head MEG device was built by a company that emerged from Helsinki's University of Technology low-temperature laboratory and is now the leading equipment manufacturer in this field. MEG plays a major role in the European Union's new AI Mind project, and the goal of this €14 million project is to learn ways to identify the patients whose dementia could be delayed or even prevented. For this to happen, neuroscience and neurotechnology need help from artificial intelligence experts. Dementia is a broad-reaching neural function disorder that significantly erodes the sufferer's ability to cope with everyday life. The most common illnesses that cause dementia is Alzheimer's disease, which is diagnosed in 70 to 80% of dementia patients. That's why the AI Mind project uses a tool referred to as the fingerprint of the brain. It was created to investigate whether MEG measurements could detect a person's genotype. More than 100 sibling pairs took part in the study that sat subjects in an MEG, first for a couple of minutes with their eyes closed, and then for a couple of minutes with their eyes open. Researchers then compared the graphs and genetic markers, and found that a computer could learn to distinguish the individual perfectly based on just the graphs, irrespective of whether the imaging had been performed with the test subject's eyes open or closed. One objective of the AI Mind project is to learn ways to screen individuals with a significantly higher risk of developing memory disorders in the next few years. Researchers plan to image 1,000 people from around Europe who are deemed at risk of developing memory disorders and analyze how their neural signals differ from people free from cognitive deterioration. Artificial intelligence will then couple their brain imaging data with cognitive test results and genetic biomarkers. Researchers believe this method could identify a heightened dementia risk in as little as a week. What's important about this early identification is that they could implement lifestyle changes like a healthier diet, exercise, treating cardiovascular diseases, and cognitive rehabilitation, which could significantly slow the progression of memory disorders, in turn giving the patients many more good years to live. Identifying at-risk individuals will also be key when the first drugs that slow disease progression come onto the market, perhaps in the next few years.